Hello guys, welcome to SKK Classes NZ again. So in our previous video, we already discussed about vital signs, that what are vital signs, and we discussed about temperature, pulse. Okay, now today we're going to discuss about the respiration as well as the blood pressure. Okay, because these are also the main important part of the vital signs. Okay, so now let's discuss what is respiratory rate. So respiratory rate or respiration rate, that refers to number of breath per minute. What it means? It means that in 1 minute you will breathe 12 to 20 breath. Okay, in average adult, and this parameter can get changed according to age, according to your activity level. Okay, for example, if you are doing some exercise, so if you will count your respiratory rate at that time, so it will be more than 20. Okay, but if you are like just your body is total relaxed, and then you will count your respiratory rate, then it will lies between 12 to 20 breath per minute. So this is a normal rate of the respiration. Okay, and parameters which are important here, that include your rate of respiration. Okay, then comes your depth of breathing, then comes your pattern of breathing. Okay, means rate, what's the respiratory rate, from there we can judge that what's the condition of patient. Is it the patient is having a high respiratory rate or low respiratory rate? Okay, then comes your depth of breathing, that how deep you are going to inhale and how deep you are going to exhale, and how much pressure you are going to do before expelling the carbon dioxide from the body. Means whenever respiration having a two cycles. Okay, one is inhalation, number two is exhalation. Okay, so what is inhalation? When you are going to take oxygen inside the body. Okay, that is your inhalation or inspiration. Then comes your expiration. Expiration, what it is, what is that? When you're going to remove the carbon dioxide from the body, so that is your expiration. And this cycle, okay, in 1 minute to be repeated with, between 12 to 20. Okay, so in 1 minute you are going to breathe 12 to 20 times. But if respiration rate is more, it means there is some condition. Okay, suppose if the patient is coming in the hospital and he is taking very deeply breathing. Okay, and means doing putting a lot of pressure to inhale and to exhale, so it means that there is something problem. Okay, so according to that the doctor will manage. So these are the main vital signs. From temperature, from the body temperature, doctors can assess, okay, that this patient is having a fever or not. Then in same way, pulse. Okay, if your pulse rate is more, it means you are having some problem. Okay, in the same way, if the respiratory rate is more than normal, it means that there is something wrong in the patient. And next is your most important vital sign, that is your blood pressure. Okay, means what now? What is blood pressure? So in simple words, I will say the blood pressure is the force of your blood against the walls of your arteries. Okay, means how much pressure is exerting by the blood against the walls of arteries, that is known as is your blood pressure. And there are you can say, and each time when your heart beat, okay, so it pump the blood into the arteries, and your blood pressure is the highest when your heart beat, pumping the blood, so that is known as systolic pressure. Okay, means there are two types of blood pressure are there. Number one is systolic blood pressure. Number two is diastolic blood pressure. So let's discuss about the systolic and diastolic blood pressure. Okay, the normal range of blood pressure is to 120 via 80 mm of Hg, and blood pressure is measured with the help of sphygmomanometer. Okay, and like 120. Okay, I have that I already told you that 120 via 80, that is the normal limit. So 120 that is your systolic blood pressure, and 80 that is your diastolic blood pressure. Now see in this picture, the systolic and diastolic blood pressure definitions are given. So what is systolic blood pressure? So this is the pressure which is exerted when blood is ejected into the arteries. Okay, so means when the blood is going into the arteries. So that is your systolic blood pressure, and normal systolic blood pressure is 120 mm of Hg. Then comes your diastolic blood pressure. So what is diastolic blood pressure? The pressure of the blood exerts within the arteries between the heartbeats. Okay, so means between two heartbeats, or you can say the how much pressure the blood is exerted into the in the arteries, that is your diastolic blood pressure. And normal limit of diastolic blood pressure is your 80 mm of Hg. Okay, and how we can measure the blood pressure? We should measure the blood pressure with the help of a special instrument that is known as your sphygmomanometer. Okay, so this is all about the blood pressure. And one thing and which I would like to clear, that if your blood pressure is high, okay, means if your blood pressure is high, more than 120, okay, and 80, so it means you are having a hypertension. Okay, and if the patient is having a low blood pressure, that is known as hypotension. Okay, if you people remember that I made already a one video which is related to hypertension. Okay, that hyper. Okay, so this is all you can say the main parameters or main vital signs which help us to assess the condition of the patient or a person. Okay, means from temperature of the person, from the pulse of the patient, okay, and respiratory rate and blood pressure. So these are the four main vital signs from where we should know what is the condition of the patient or a person. So according to that, we should start the management. Okay, so this is all about the vital signs. So this is all about the vital signs, that is your temperature, pulse, respiratory rate, and blood pressure. Okay, in my upcoming video, I am going to bring a new topic that is related to the abnormalities which are related to the vital signs. Means if there is some, like if the blood pressure is high, then blood pressure is low. If the pulse is high, okay, so according to that we should discuss about the main medical terminology, that what we people use in the hospital setting or in the emergency setting. So we will discuss that medical terminology in our next video. So till then, thank you for watching SKK Classes NZ, and please don't forget to subscribe my channel. Thank you.